This year's State of World Population Report shows the impact of poverty, lower levels of education attainment, and labor force participation on unintended pregnancies. It also highlights the effects of labor force participation and exposure to violence and coercion on pregnant women. The research was conducted by the United Nations Population Fund. The fund's regional director is Dr. Bannet Ndyanabangi, who joins us now via our video link to get us a bit more into what this report has actually found. And Doc, it's great to have you on the program. Thank you so much indeed for making time. You know, our conversation now around unintended pregnancies is quite timely, some might say, because of what's taking place in the U.S. with the Supreme Court overturning that Roe v. Wade ruling. We'll speak about that impact potentially in just a moment, but let us in on what this report has found typically leads to unintended pregnancies in South Africa.
Well, thank you for having me on your program this morning. As you said, this is a report which the United Nations Population Fund issues annually. And this report usually focuses on themes, on current issues. Now, this report focuses on the issue of unintended pregnancies and their consequences. The report found out that nearly 50% of all pregnancies in the world, which is about 121 million pregnancies each year, are unintended. And therefore, the title of the report is Seeing the Unseen, because this is a crisis which actually people don't see and don't talk about. Coming back closer to our region, if you look at Southern Africa, we have 65% of pregnancies that happened between 2015 and 2019 being unintended, and 36% of them ended in abortion. If we look at the other side, East Africa, here we had 47% of the pregnancies unintended and half ended in abortion. So really, it's a crisis and it's unseen and it's not talked about. And it affects even more the young people. For example, if you look at the birth rate of adolescents in Eastern Southern Africa, we have 10 out of 100 girls between the age of 15 and 19 in 2020 giving birth. And this is compared to 4 out of 100 in the world. So it's an issue we really have to face and we have to address it.
Absolutely, because, you know, when we speak about pregnancies, especially among young people, it's more than just got to do with their health. You know, you get into the realm of autonomy, future life prospects, how poverty intersects with that reality. When we speak about unintended pregnancies, how much of that coincides with unwanted pregnancies? Because I'm sure you'll agree there is a slight difference.
Yes, there is a difference. Again, women try actually to avert unintended pregnancies, but despite all the efforts, it happens. Some of it, some become pregnant out of violence and coercion, and for others it is a default. So unintended could be wanted. For example, you are in a marriage and you get married and you enjoy your sex and you get pregnant and you welcome the baby. That was unintended, but it is welcome. At the end of the day, you are in a marital relationship, you wanted to get pregnant. But it was unintended to wanted. Now, there are those which are unintended and unwanted. In cases of violence or coercion, young women having no access to contraception. So really that's like the difference. So sometimes the unintended are welcome, we are happy, we welcome the baby, but many of them really are unwanted and end up in abortion.
What the report has also found is that South Africa in the region is leading when it comes to the number of unintended pregnancies. I wonder whether the report sheds any light on why that is, because legislatively, if you don't want a child in this country, you're able to legally have an abortion, but there are also several other modes of contraception that are available, supposedly.
Yeah, I think there are many other factors which come into play. Take an example of what happened during COVID now. COVID, many girls stayed at home. As a result, they were vulnerable because there were many restrictive measures, schools closed, and the girls spent more time with men and boys than they would have been if they were in school. and this led to a greater likelihood of engaging in risky behavior. So the teenage pregnancies can be due to lack of education on sexual and reproductive health in the home, if there is lack of guidance. But there are many factors really which can lead to all this. The pandemic, as we know, led to an uptick in teenage pregnancies in many countries, including South Africa. We have an example in Malawi where we got the exact data, which showed that in March to July 2020, the number of cases of teenage pregnancies increased from more than 20,000, about 44,000, compared to the same period in 2019 before the epidemic. So there were really many issues, and there are many other factors beyond that you can access legal abortion, beyond that you can access contraception. So I think that those are some of the contributing factors.
I wonder how worried we should be in sub-Saharan Africa around what's taking place in the global north, specifically in the U.S., with the overturning by the Supreme Court of that Roe v. Wade ruling. It's still too early to tell, I'm sure. But, I mean, from the work that you've been able to do yourself, what do you reckon is going to be the ripple effects of something like this in a context where we're dealing with what you've described as a crisis?
Yeah, I think the ruling in the U.S. was very unfortunate. I always say we really need to know that no woman goes out and says, I'm going to have sex, I'm going to get pregnant, and then I'll have an abortion. No. There are many factors which lead to that. Lack of access to service, information, especially for young girls. So I think in our region, we need to remain steadfast. We have made some progress. We need to really strengthen the policies, listen to the voices of women, when we design the responses, and really not be weighed by what has happened, the unfortunate happenings in the U.S. So we need to invest in strengthening health systems so that women can access reproductive health services which are stigma-free and support their bodily autonomy. And again, our leaders really have to support women, promote gender equality in all areas of policy, and break down the barriers so that women can complete education, they can enter the workforce, and we should develop supportive programs, social support programs for our women, and raise their value and have everybody, family members, media, religious leaders, to value women and girls beyond motherhood. You know, we need to insist in their equal value and demand that they are recognized in every turn, from the home to the clinic and to the country's capital building. So it's a tough choice, and I think we have made progress, and we shouldn't really be taken aback by what happened in the U.S.
Yeah, hopefully the impact is not detrimental to us here in the global south. Dr. Bannet Ndyanabangi, thanks very much indeed for speaking to us. Really do appreciate your time. The good doctor is the regional director for the UN's Population Fund. They put together that State of World Population Report, releasing the impact really, or the contributing factors to unintended pregnancies in South Africa.